Welcome to the 2018 Turning 65 Medicare and Social Security Educational Seminar. This seminar will help you understand Medicare and the basics of Social Security. Medicare has not reviewed or approved of this presentation, nor has the Social Security Administration approved, endorsed, or authorized this presentation. Medicare does not review educational seminars. Thank you, and enjoy the seminar. Medicare and Social Security are your two most important entitlement programs. Medicare provides you basic health coverage, and Social Security provides you a level of income. This seminar will help you understand each entitlement program and how they intertwine for your benefit. In this seminar, we will review the basics of Social Security, the basics of Original Medicare, Medicare Advantage and Medicare Supplement plans, the Prescription Drug Program, Medicare enrollment periods. Two basic Social Security terms you need to know are: number one, full retirement age is referred to as your FRA, which is the age you will first become entitled to full or reduced retirement benefits. And number two, primary insurance amount is referred to as your PIA, which is the income benefit received at your normal retirement age. SSA is a short abbreviation for the Social Security Administration. There are many factors you must consider when you start Social Security in order to maximize your income benefit, such as your PIA and FRA, how much income you are entitled to when you reach your full retirement age, your perceived life expectancy, if you have a spouse, are you still working, Medicare and Social Security coordination. Understanding all of these factors are critical to get the most income for your Social Security. FRA, or full retirement age. FRA used to be age 65, and many people still believe age 65 is full retirement age. FRA is gradually increasing to age 67, starting with people born in 1943 or later. In 2018, people born in 1952 will reach FRA at age 66. Anyone born after 1960? Their FRA is age 67. Early filing can occur starting at age 62 up to your full retirement age. You can also delay filing up to age 70. Filing earlier or later than FRA will change your monthly income benefit amount. Social Security takes into consideration your best 35 working years. You can access your earnings record online by establishing an online account at www.ssa.gov/myaccount. This site also provides valuable tips to maximizing your Social Security. In this earnings record example, the top number, $1,554 per month, is the primary insurance amount, or PIA, at full retirement age, FRA. The middle number, $1,938, is the PIA at age 70, and the bottom number, $1,072, is the income benefit at age 62. As you can see in this example, there is almost a $900 per month difference between filing for Social Security at age 62 and filing at age 70. At what age you decide to take your Social Security has a big impact on the amount of your Social Security benefit. This chart illustrates the percent increases and decreases in PIA from an FRA of age 66. At age 62, there is a 25% decrease in PIA benefits, and at age 70, there is a 32% increase in PIA benefits from age 66. Between age 62 and age 70, the PIA benefit increases 57%. Deciding when to file for Social Security has a major impact on the amount of the income benefit. There are 4 special Social Security benefit considerations. Number 1, spouses can collect Social Security benefits if they have no earnings and no PIA. They are eligible for 50% of the working spouse's PIA. Number 2, survivors must have been married 9 months unless death is by accident, and the survivor must be at least 60 years old, unmarried for reduced benefits, or FRA for full benefits. Number 3. Benefits are reduced $1 for each $2 if taken before one's FRA, reduced $1 for each $3 if taken the year of one's FRA, and no reduction if benefits are taken the month of one's FRA. Number 4. If you are divorced, you can collect your ex's Social Security if you were married for at least 10 years. You are 62 years or older and are unmarried. You have been divorced for at least 2 years, and your ex's PIA would be less than your own PIA. Established in 1965, Medicare is a federal health insurance entitlement program and is designed for the aged and disabled. To qualify for Medicare, you must be a U.S. citizen or have a resident visa in the United States for 5 consecutive years. You must be 65 or older or getting disability benefits for 24 consecutive months, or have kidney failure or end-stage renal disease, or approved Social Security disability with a diagnosis of ALS, Lou Gehrig's disease. Medicare is changing the look of the Medicare card. The Medicare card will not have the beneficiary's Social Security number, but replaced with a random encrypted number for protection against fraud and identity theft. If you are married and did not pay into Medicare by working 40 working quarters, you could be covered by Medicare if your spouse worked 40 working quarters and paid into Medicare. It is important to understand that Medicare and Social Security are 2 different federal entitlement programs. You can enroll in Medicare Parts A and B at age 65. If you are disabled for 24 consecutive months, you can enroll in Medicare. As early as age 62, you can elect to sign up for Social Security. At what age you elect to start Medicare and Social Security is your option, but you can start at different times. If you have health insurance through your employer, you do not need to start Medicare till you are no longer covered due to retirement or your employer eliminates health insurance for its employees. Medicare comprises Part A and Part B health benefits. Part B has a monthly premium you must pay when you start Medicare. Some options to consider. Number 1. If you start Medicare and do not start Social Security, then you will have to pay Social Security directly for your Part B premium. Number 2. If you start Medicare and start Social Security, then your Part B premium will be deducted from your Social Security check. Number 3. If you do not start Medicare and you start Social Security, then you do not pay a Part B premium until you start Medicare. Medicare gives letters to its types of health coverage. Part A is your hospital coverage, such as inpatient services and skilled nursing facilities. Part B is your medical coverage, such as doctor, lab, outpatient services, and durable medical equipment. Part C is the Medicare Advantage plans, available to you through private insurance companies. These Medicare health plans cover the Medicare benefits under Part A and Part B. Many of the Medicare Advantage plans also cover Part D prescription drug coverage. Part D is the prescription drug benefits available also through private insurance companies, but regulated by Medicare. Medicare does not deliver Part D benefits. We will cover in detail Part A, Part B, Part C, and Part D, so you will have a thorough understanding of these components of Medicare. Part A eligibility is for those age 65 or older, or their spouse, who paid Medicare payroll taxes for 40 working quarters. The 40 working quarters do not have to be consecutive quarters, just 40 quarters during your working years. Individuals who had at least 30 quarters of coverage or were married to someone who had at least 30 quarters of coverage may buy into Part A at a monthly premium rate of $232. For those with less than that of 30 quarters of coverage, the monthly premium is $422. Because of income and assets, some individuals could have their Part A premium subsidized by a federal program named Qualified Medicare Beneficiary, or QMB. Part B eligibility is for those 65 or older and those under 65 disabled for 24 consecutive months. Unless you have health insurance from your employer or your spouse's employer, for each 12-month period you delay enrollment in Medicare Part B, you will have to pay a 10% Part B premium penalty for as long as you are in Medicare. The graphic is a fun way to illustrate that Original Medicare has exclusions and limitations that can cost you a sizable amount of money. There is no medical coverage outside the United States. There is no coverage for routine vision, dental, hearing, and podiatry. No coverage for acupuncture, hearing aids, or dentures. No custodial care or nursing home care. Medicare has deductibles, coinsurance, and a Part B premium. Because Medicare does not cover all your health needs, there are financial risks associated with Medicare. If you elect to only have Original Medicare as your health insurance, you should purchase a Part D standalone prescription drug plan. The standalone prescription drug plan will have a cost associated with the plan. When you are eligible to enroll in Part D, there can be a penalty if you do not elect to purchase a Part D. This Part D penalty will be discussed later in this seminar. Your Part B premium is based on your adjusted gross income from your previous 2-year return. For 2018, your Part B premium is based on your 2016 adjusted gross income. In 2018, for someone new to Medicare, the standard Part B premium amount is $134 or higher depending on your income. For those already on Medicare, the basic Part B premium, unadjusted for adjusted gross income, is $109 each month. Your Part B premium is also based on how you file your tax return: single, married filing joint returns, or married filing separate returns. Increases or decreases in your adjusted gross income results in an increase or decrease in your Part B premium for the current year. In 2018, Medicare has a Part A $1,340 deductible per benefit period. That means when you check into the hospital, you are responsible for the first $1,340. After the deductible, for each day you are in the hospital per benefit period, from 1 through 60 days, the coinsurance is $0. For days 61 through 90, the coinsurance is $335 per day, and for days 91 through 150, the coinsurance is $670 per day. For example, if you are in the hospital for 90 days, you would be responsible for the $1,340 deductible and 30 days of coinsurance at $335 per day. Remember, for the first 60 days of the 90 days, there is no coinsurance. You would then pay a total of $11,390. For stays in a skilled nursing facility, there is no coinsurance for the first 20 days, but for days 21 through 100, there is coinsurance of $167.50 per day. Part B service costs has a $183 annual deductible and a 20% coinsurance for Medicare-approved services and items, such as in-office chemo drugs and services. Part C refers to Medicare Advantage health plans. To enroll in a Medicare Advantage health plan, you must be enrolled in Part A and Part B and reside in the Medicare Advantage health plan's service area. Benefit coverage in a Medicare Advantage health plan must be actuarially equivalent or better than coverage under Medicare Parts A and B. Medicare Advantage health plans may include benefits not covered by Medicare Parts A and B, such as dental, vision, gym, transportation, and acupuncture. Medicare Advantage health plans may include a Part D prescription drug plan. Medicare supplement plans are not covered under Part C and will be covered later in this seminar. There are many features for an HMO Medicare Advantage with Part D plan. You must pick a primary care physician, or PCP, and stay within the PCP's medical group network of physicians, specialists, and hospitals. Your network medical group coordinates care for inpatient and outpatient services. Except for certain screening services, such as a mammogram, in most cases, you need your primary care physician to refer you to a specialist. Medicare Advantage plans may have no monthly premium. Most Medicare Advantage plans have low or no copays for many services, such as hospital and physician office visits. There are no deductibles for Part B and Part D. Medicare Advantage HMO plans may include health and wellness programs and extra benefits such as dental and vision, gym, transportation, acupuncture, chiropractic services, and worldwide emergency coverage. Available through private insurance companies, Medicare Supplement Insurance covers the financial gaps in Medicare's deductibles, coinsurance, and copayments. The Medicare Supplement Insurance benefit chart details each lettered Medicare Supplement plan and its respective coverage of Medicare's deductibles, coinsurance, and copayments. None of the plans cover Part D prescription drugs. If you want drug coverage with a Medicare Supplement plan, you must also purchase a standalone prescription drug plan. Plan F covers 100% of all Medicare deductibles, coinsurance, and copayments. At a lower monthly premium, Plan F with a high deductible is also available from some insurance companies. Plans M and N with coinsurance and copayments are generally price competitive with other plans. For plans K and L, there is a yearly maximum out-of-pocket maximum. Value-added benefits, such as wellness benefits, are not included on the chart, as each insurance company has the latitude to provide these benefits on a plan basis. Before purchasing a Medicare Supplement plan, check with the insurance company as to the value-added benefits available to you. When you join Medicare, you have the option to remain on Original Medicare, or select a Medicare Supplement plan, or a Medicare Advantage plan. Here are some of the differences between a Medicare Advantage plan and a Medicare Supplement plan. A Medicare Supplement plan has limited guaranteed issue options, while a Medicare Advantage plan with prescription drug coverage, also known as an MAPD, is guaranteed issue except for end-stage renal disease. With the supplement plan, you have direct access to specialists, while with MAPD plans, you must select a PCP, get referrals to specialists, and you must stay within a designated provider network. Supplement plans have a monthly premium, and your monthly premium increases over time. MAPD plans have no or low monthly premiums. Supplement plans can have copays based on plan selection, while MAPD plans have no or low copays but could have coinsurance for services such as radiation therapy. For supplement plans, you must purchase a standalone prescription drug plan. With MAPD plans, prescription drug coverage is included in the plan. Generally, supplement plans have no or limited value-added services, while MAPD plans do include value-added services such as wellness, fitness, dental, and vision. With supplement plans, you must purchase coverage for foreign travel. With MAPD plans, urgent and emergency coverage is provided for foreign travel. Special needs plans, or SNP health plans, are designed to aid a special segment of the population. Low-income Medicare and Medicaid beneficiaries, or duals. The chronically ill. Institutionalized beneficiaries. SNP health plans can include additional benefits such as case management, enhanced prescription drug coverage, free diabetic supplies, transportation, acupuncture and chiropractic services, over-the-counter supplies. According to the National Conference of State Legislators, NCSL, in 2017, employees paid $5,714 toward the cost of their health insurance. Medicare-eligible employees should consider the costs and health benefits of remaining on their employer's health insurance versus joining Medicare and subscribing to a Medicare Advantage plan. Employer health plans generally have employee contributions and costs associated with the health plan, such as deductibles up to $10,000, physician copays, hospital coinsurance, and limited wellness benefits. Medicare Advantage plans have a Part B premium, but may have $0 copayment for physician, hospital, laboratory, and other services. These plans can include prescription drug coverage and also wellness benefits, such as gym, transportation, dental, vision, and emergency coverage outside of the United States. Part D, prescription drugs, is a key component of your health plan, whether you add it to Original Medicare only, to a Medicare Supplement plan, or Part D is included in your Medicare Advantage plans. In the following section, you will learn Part D enrollment periods, Part D penalty for not enrolling, Part D Premium. All Part D prescription drug plans must minimally be actuarially equivalent as set by the government. Private insurance companies offer Part D prescription drug coverage either on a standalone basis or through Medicare Advantage. Medicare does not administer Part D. You must have Part A and/or Part B to be eligible for Part D. You must enroll in a Part D prescription drug plan, or, when you do enroll, pay a 1% penalty for each month when you do have Part D. The basic Part D prescription drug benefit is an annual deductible of $405, which may be waived by the insurance company. The initial coverage limit, ICL, benefit of $3,750. Once you hit $3,750, you enter the gap or donut hole, where you're responsible for paying a share of the cost for your drugs, 44% of generic drugs, 35% of brand drugs. Some plans provide free generics in the gap. Once you spend $5,000 out of pocket, referred to as TROOP, in the gap, you're entitled to catastrophic coverage, where your drug costs are $3.35 for generic and $8.35 for brand drugs. Each year, Medicare rates the Medicare health plans for their health and prescription drug coverage services that is summarized into a single star rating. The star rating of the plan's performance makes it easy for you to compare plans. A plan's star rating is reviewed each year, and the results are available each fall. A plan can get a rating between 1 and 5 stars, ranging from poor, 1 star, to excellent, 5 stars. At any time during the year, you can switch one time to a plan that has an overall 5-star rating. There are 5 Medicare enrollment periods you need to be aware of. ICEP, Initial Coverage Election Period, is your initial enrollment into Medicare, Part A and Part B, and begins 3 months before your 65th birthday, includes the month of your birthday, and extends 3 months after your 65th birthday. If you work and have credible health insurance coverage, you can wait to enroll in Medicare, say at age 66 or older. Then, when you leave your credible health coverage, you can wait 63 days to enroll in Medicare or pay a 10% Part B penalty. IEP, Part D Initial Election Period, is a special enrollment time to enroll in Part D if you lost credible Part D coverage or did not enroll in Part D during your ICEP. SEP is a special enrollment period, and it's for those experiencing unique qualifying events, such as moving, and your existing Medicare health plan is no longer offered in your new location. OEP, or AEP, known as Open or Annual Election Period, normally runs between October 15th and December 7th, whereby you can change your Medicare Advantage or your standalone prescription drug plan. MADP, Medicare Annual Disenrollment Period, the time between January 1st through February 14th, where you can drop your Medicare Advantage plan and return to original Medicare, and/or add and drop a Part D plan as an option for your Medicare Supplement plan. Medicare has excellent resources for information about Medicare. You can go to the Medicare website at www.medicare.gov or call Medicare at 1-800-MEDICARE. For help with Social Security, you can go online at www.ssa.gov or call Social Security at 1-800-772-1213. TTY users should call 1-800-325-0778. For questions about Medi-Cal, their website is www.medi-cal.ca.gov or call 1-800-541-5555. This educational seminar is a production of Beta Benefits Insurance Services, Irvine, California. If you are attending a Turning 65 meeting, you may ask your presenter for their business card. If you're viewing this presentation online and want help with your Medicare, proceed onto the website to the Contact Me button. Click on the button and complete the contact information form, and submit. A licensed insurance agent will contact you and help you with your questions. Thank you for your attendance to the Turning 65 Medicare and Social Security Educational Seminar.